Doctors, we're excited to present to you the Zenith Model 100 Full Spine Flexion Distraction Adjusting Table. This is a table that provides for the widest range of patient needs and treatment protocols. Included in standard features are a 5-year limited parts warranty, our exclusive cervical distraction headpiece with cervical flexion, extension, lateral flexion, pivotal rotation, and the cervical assist handle. The tilting headpiece also includes a face paper toweling dispenser. The thoracic cushion is available with the optional pivotal thoracic rotation. The caudal flexion distraction section includes a power balance leaf spring design and a tension indicator. This system preloads the spring tension for the caudal section. It includes a remote foot switch for operating the table from either side and a caudal assist handle. The caudal section includes lateral bending, flexion extension, and the circumduction feature as standard equipment. Also included are manual plane traction, which adjusts the table length for patient size. Adjustable ankle rest with ankle cuffs and lumbar roll are also standard features. And that concludes the standard features of the Zenith Model 100 table. There are a number of important options available on the Zenith Flexion Distraction Table system. One of the most popular is the automatic axial distraction system with the deluxe fold-away caudal assist handle. This provides an excellent decompression therapy system to the doctor. Included with that are the deluxe touch buttons for speed control, on and off, and a foot switch to operate the table from either side for axial distraction comfort. When completed, the fold-away deluxe handle retracts into the table frame for easy access to the patient. Another important feature would be the optional drops. This table can be built with manual pelvic drop, manual thoracic drop, or air-controlled recocking drops for either section. Also available are pivotal thoracic rotation and pivotal caudal rotation for scoliosis patient care. A new and important option are the abdominal swing away, which drops down for patient comfort, and another option is a raised pelvic, which upgrade the table for most any technique. Another new option are the touch buttons, the operative switches for elevating and lowering the table for doctors' best comfort. And that concludes the operative options for this table. Doctors, in this section we're going to describe the operative features and the equipment that's shown on this deluxe table today, including the options. We'll start at the top of the table with the cervical distraction headpiece system, which is exclusive to the Zenith Model 100 table. It provides a full range of motion for flexion extension, lateral locking, open, combining lateral flexion with flexion extension provides circumduction standard to the equipment. And lastly, the rotation feature. Included is a retractable handpiece. The full handpiece can be used for a leverage motion to assist in rotation. Lateral can be left open or locked to assist in that motion. And locked again. Also included are occipital cups to tether the patient securely. Eye cups are provided for patient position and comfort. Paper toweling system for patient relaxation. And at the end of the table we have flexion spring tension for various patient weights. As you can see on the side of the frame on both sides, we have indicator markings to denotate where the range of motion improvement has occurred. So each stair step on the side provides markers for the doctor to detent and lock positions for the patient's comfort and treatment. That concludes the cervical flexion distraction section of the Zenith 100 table. In this section we'll talk about the thoracic section of the Zenith flexion table. This table is equipped with an option for thoracic pivotal rotation for scoliosis straightening. It'll rotate for 25 degrees right or left and lock in any position for a treatment pivot point. It's also available with an optional drop at the caudal edge under the edge of the ilia at this pivot point. And we've also included today the operative touch buttons to operate, raise and lower the table from either side. And then lock it again in any position. And that concludes the thoracic section of the Zenith flexion table. In this section we'll discuss the various standard features and options on the Zenith flexion pelvic caudal section. This table is equipped with a deluxe fold-away handle which locks in any position to complement the doctor's treatment stance. It also includes various other options that operate the axial distraction system. I'd like to begin with the center of the table and work towards the foot. This table includes a power balance spring system to easily counterbalance the weight of the patient for strength and ease the doctor's treatment. It can be made as light or as strong as necessary for different patient weights. This handle is a flexion lock. As you can see, the table will go into flexion and extension quite easily. Also standard are the locking lateral system, which allows the table to go sideways, combined with the flexion distraction handle that provides circumduction as a standard feature of the table. It can be locked in any position for other protocols. This table today includes the pelvic drop at the cephalad edge, the front edge of the pelvic cushion. There's a cocking handle on either side. For actuating the drop, simply thrust. Tension control is running through the system to either side. This wand controls the strength plus or minus for the drop tension. The next feature we'll discuss is the automatic axial distraction system, which is great for decompression therapy. The table is on and ready for treatment. It allows for a total of 10 inches of treatment, automatic, and all I'm doing, doctors, is pulsing the button. I also have available foot switch on the floor that I can treat full spine due to foramen magnum pump. There's a speed control for slow pulse or at the most rapid speed. Of course, it can be shut off in any position to allow for traction, for static, or for mobilization. The minimum and maximum length of travel are an additional 10 inches of excursion. At the foot end, we include an adjustable ankle relaxer system which locks in any position for patients taught treatment, and ankle cuffs which simply Velcro over the malleoli.